Mental health. We hear that phrase all the time, right? But what does it actually mean? Beyond the cliches and the stereotypes. In this explainer, we're going to cut through all that noise and get to a real, solid understanding of what mental health is and why it's so much more than just not being sick.
So a lot of us think about it this way. Hey, if I don't have a diagnosed condition like depression or anxiety, then I'm good. My mental health is totally fine. It's a simple black and white way to look at it. But is that really the whole picture?
Not even close. The World Health Organization gives us a definition that's so much bigger and more active. I mean, think about these words for a second. Realizing your abilities, coping with normal stress, working productively, contributing. This isn't about just avoiding a problem, it's about actively thriving.
So let's break that down. Mental health is basically a three-legged stool. You've got your emotional, your psychological, and your social well-being. It's the engine that powers how we see the world, how we deal with challenges, connect with other people, and really how we make pretty much every choice every single day.
Okay, so we've got this bigger, more holistic definition. But this isn't just some abstract idea. Let's make this personal. Let's dig into the connection between our minds, our bodies, and our lives, and why this stuff truly matters to every single one of us.
Let's just start with a number. 970 million. That's how many people around the world were living with a mental health disorder back in 2019. This is not a small, niche issue. It is a massive global reality. Now, check this out, because this chart really puts things into perspective. When you look at it this way, you realize that mental health conditions are actually more common than things we talk about all the time, like diabetes or even heart disease. This isn't something that just happens to other people. It's a core part of the human experience. And this is how it actually shows up in our daily lives. When our mental well-being is suffering, it's not just a feeling. It has real, tangible effects. It can mess with your grades, put a strain on your friendships, make it impossible to focus, and it can even weaken your immune system. The link between our minds and our bodies, it's undeniable. So, if mental health is this fundamental and the conditions are so common, why is it still so hard to talk about? Well, there's one huge reason that stands in the way more than anything else: stigma. Thankfully, things have gotten better over time, but it wasn't an overnight change. It really started picking up steam in the 1840s with a push for more humane conditions. Then, a huge leap forward in 1908, the very first outpatient clinic opens. And then by 1963, a major shift to bring care out of institutions and back into our communities. It's been a long, long road. And I mean, just look at the difference when you put the old views and the new views side by side. We've moved from seeing mental illness as some kind of moral failing that deserved punishment and confinement to understanding it for what it is, a health condition, just like any other, something that can be treated and managed.
But even with all that progress, the shadow of those old ideas still hangs around. That's what stigma is. It creates this sense of fear and shame. It leads to discrimination, and the most tragic part, it builds this wall of silence that literally stops people from reaching out for the very help that could change or even save their life.
And it's important to get that stigma isn't just one thing. It works on a few different levels. You've got public stigma, that's the prejudice you get from other people. Then there's structural stigma. We're talking about policies that create barriers, like insurance that doesn't cover mental health care fairly. And then there's maybe the hardest one, self-stigma. That's when we internalize all that shame and start to believe we're somehow broken.
Okay, so understanding the problem is step one, but we're not gonna just stay there. Let's shift gears and talk about solutions. Let's look at the actual path to wellness and some real, concrete steps we can all take to empower ourselves and the people around us.
Here's a really simple but powerful way to remember it: the 5 C's. It all starts with care. You got to practice self-care. Then connection. We all need our people, our support system. Then courage, having the guts to speak up about how you're feeling. Compassion for yourself and for others. And finally, consistency. Because wellness isn't a one-time thing. It's built from all those small healthy habits you do over and over. And those C's aren't just ideas. They lead to real-world actions. Things you can do for your body, like getting some exercise or enough sleep. Things for your mind, like making time for a hobby you love or trying out mindfulness. And things for your spirit, like just having an honest conversation with a friend you trust. These aren't magic pills, but they are absolutely powerful tools for building up your resilience. And that brings us to what might be the single most important idea in this whole explainer. This is the one that just blows stigma right out of the water. Asking for help isn't weakness. It is a profound, incredible sign of strength. Period. So that leaves us with one final question to think about. We know what mental health is, we know why it's so important, and we know it's standing in the way. The question now isn't just for society, it's for each of us. What's one thing, just one thing, you can do today to make it just a little bit easier for someone, maybe even yourself, to take that strong, brave first step?